Anishinangi miniko sema, chiganoninan. Manito, hatsukana gaye, wapanong, shawanong, ningabi anong, kiwetinong. Kimama nan gaye migwech, nindina. Migwech gaye, nindinag. Kagipimatisyo at mehensha. Wito kawushinam, minik kenibimatisyang.
This story is Bimaadiziwin, a healthy way of life, about health and medicine. Bimaadiziwin, Nindigenikaz, Makwa, Indo Dam. Winona LaDuke from the White Earth Reservation. For centuries, the Anishinaabe Ojibwe lived in the Great Lakes region before contact with Europeans. The Ojibwe, also known as the Chippewas, strived for a healthy and long life by living in balance to achieve Bimaadiziwin.
Bimaadiziwin means to me is to have a good life and to be thankful for what I have. Means good. Bimaadiziwin is living a good life.
My grandparents were my elders, and they taught me through the Mother Earth, drawing the circle on the earth. They taught us that there are 4 parts to our whole, and that there is the emotional part, the physical part, the mental part, and the spiritual part.
The medicine wheel symbolizes the 4 aspects of all humans in the circle of life. This also represents the 4 directions. There are instructions that have been passed down from the medicine wheel about how to live in balance and how to stay on a healthy path of life.
There's 4 of them, and we're reminded of them by 4 natural symbols. And the first direction, or the first symbol, is represented by sweetgrass. And in fact, that road, that path we went on, some call it the Red Road, but others call it the Sweetgrass Road. So sweetgrass is to remind us of that first direction, that first instruction, and that is that we must always be gentle. And if we're gentle, then we'll be able to stay on that road. That second direction, the second commandment, the second guidance is represented by another of our relatives, Metig, the forest, the tree which grows and stands tall, and that's to remind us to be truthful. And so if we're gentle and if we're truthful, then we'll be able to continue down that path. And then that third instruction, that third direction is, we're reminded of it by another relative, Waasa-Inaabidaa, the deer. And that's that we must share. And if we're gentle and if we're truthful and if we share, then we'll be able to stay on that road. And then the fourth and final is represented by our oldest relative, the Asin, the grandfathers, the stone. And that's to remind us that we must be strong. And so the elder said, if we're gentle and truthful and if we share, and if we're strong, then we'll be able to stay on that path.
The spiritual part of oneself needs to be strong, because if you don't have a strong spirit, the rest of you weakens, and then you might go off the pathway.
Akuzi. Older man said Akuzi being sick, but he said the literal translation, he said akuzi literally means this, akuzi. He said it's kind of out of balance, we use it for sick today, but he said when you're not akuzi, you're like this, you're back in this way here too, and then you get to akuzi, and you're this way. And one of the things that can create akuzi is, it could be physical, it could be spiritual, intellectual process too, and emotional.
Kwewezes ogi gichi akuzi izen idash gegete go jeni bud. Akiwenzi ogi nag ikwewag ga ayawad ima ishkunaganing. Ginawa gigi kendana wa iye ga mina gozi yang Bimaadiziwin oma aking. Ojitun wigiwam ninga mane 2K. Jinandu tamawag awe kwewezes jimi nagozid Bimaadiziwin. Mi dashaye bejinek oshki medewigan. Idash medewigan gia nokimagak. Idash oshki ayawag gi mashkawaziwag. Gia yamagad mino Bimaadiziwin.
You need that health, and we have been given our health through our relations, through our friends, through our ceremony, and through our genes. Everything we do is there for us to stay healthy.
Religion and spirituality was just a part of the daily living. People's physical well-being was promoted by the food they ate, the nutrition at the time. There was many lean meats, venison, wild rice, berries. I mean, we're talking very healthy foods. Exercise, just being part of, you had to move to live, which is much different than the lifestyle we have today. So there were many, many things that promoted good health. I think there's a misperception that somehow this is all there was to health, which is a great, great thing. But our spiritual healers we had, but we also had herbalists and other healers that had an expertise in medicines.
Nigi igug babayaban hagi ginatana nanda wiwe no kumisibange nimishumege migega eshichigeva ndinowe magana ke kipi na nanda wiwe watowe kiwitu kawat no ka kama shahanat.
There was gold thread on the island, which they steeped for sore throats, and blue flag, which they used for abdominal distress.
The Creator put these plants here on the earth to help us, and so I would take tobacco and thank the plant and thank the Creator for that I can use that plant for my health.
Through our relationship with the environment, we maintained our health and stayed on the path of Mino Bimaadiziwin for many, many generations. When European fur traders first arrived in the Great Lakes region, they had to adapt to the harsh environment and trade with the Ojibwe to survive.
Okay, during the fur trade, the voyageurs and the fur traders were dependent on the Indians for transportation, the snowshoe, the dog sled, the birch bark canoe. They were dependent on the Indians for food. They were dependent on Indians for clothing. And they were dependent on the Indians, just as many Europeans were in the Great Lakes region, for medicines. They relied on the Indian healing powers, powers of their herbs and the power of their their healing techniques, or otherwise they simply wouldn't have survived here.
When the troops first came up here, they brought several things with them, like malaria and scurvy. The local tribe, very forthcoming, came forward and offered spikenard plant. You grind up the roots, you make a tea out of it, and it takes care of scurvy. Translated, it has ascorbic acid in it. We know that as vitamin C in our time period. We had a chance to learn. We were vulnerable, in need, and they helped us. But we quickly became full of ourselves again and ignored many of the very useful roots, medicinal roots and herbs that they had.
Prior to European contact, it is estimated that the Anishinaabe Ojibwe population in the Great Lakes area may have exceeded 100,000 people. When the French Jesuits and fur traders reached Ba-Wa-Ting, or Sault Ste. Marie in 1605, they brought with them a set of beliefs, values, and diseases foreign to the Ojibwe people. As early as 1639, European-born epidemics spread to eastern Ojibwe villages near Georgian Bay and Manitoulin Island. By 1781, smallpox and other diseases reached western Ojibwe bands in Wisconsin and Minnesota, killing 3 to 4 children a day and cutting village populations in half.
The biggest thing that hit us immediately were the many diseases, the infectious diseases. We can look at the history and see the smallpox, the mumps, measles, the real bacteria and viruses that our immune system just had not experienced and we could not handle, and it killed us. There was an estimate of 10 million people in this country, 10 million Indian people. At one point, the estimates are it dropped to 800,000. It was the first time we were exposed, and it caused massive, massive death.
In 1801, the new century began with another smallpox pandemic, which swept through the Indian population from Canada to the Gulf of Mexico. Those hit hardest included the Ojibwe of Chequamegon Bay of Lake Superior, as well as bands in northern Minnesota along the Rainy River. In 1813, an epidemic of whooping cough and typhoid swept through Ojibwe villages in Michigan Territory, killing thousands. In 1820, an outbreak of measles took a devastating toll among the Ojibwe on the St. Croix River in Wisconsin. The mortality rate of Ojibwe was at least twice as high as that for settlers. Smallpox might kill about 16% of the settlers during a given epidemic, while Indians lost at least 1/3 of their people. There is evidence that individuals intentionally infected Native people with deadly diseases.
Could it not be contrived to send the smallpox among the disaffected tribes of Indians? We must on this occasion use every stratagem in our power to reduce them.
Contact with Europeans has had a lot of impact on the way we do things. It was not only destructive to the animals that were trapped, but it was also destructive to the Anishinaabe people. We came to depend on a lot of European trade goods, and also there was alcohol introduced, and I guess the list is endless.
Life among the Ojibwe continued to become imbalanced, and the introduction of alcohol to the Ojibwe and other tribes throughout North America during the fur trade was devastating. It was used to manipulate our people in ways that would benefit the traders.
Getting the Indians in debt became an important vehicle for keeping control over them. The use of alcohol was brought into the trade. The traders found it a convenient vehicle for getting the Indians into debt and for basically getting the Indians to do nothing other than their bidding.
I think alcohol was introduced as a way of controlling Indian people, of altering behavior. It made us crazy. I wonder sometimes personally how much alcohol had been consumed before treaties were signed at some point. And it makes me angry, as I think it does a lot of Indian people, because there were outside elements introduced that altered what we would never have done. I think, if we had clear minds in some situations, not all. And there were several factors that forced us to, I think, behave in ways that Indian people traditionally never would have.
Alcohol brought out a lot of negative behavior, negative thoughts and actions in a person's life, because there are so many things that we are powerless over. This new life that came, we're powerless over. We couldn't do anything about it. So there's then the frustrations and the resentment started to set in. See? And even though we were hanging on as hard as we could to our way of life.
And somewhere during this timeline in history, what we knew was discounted and was told that this is not good medicine, which was a real conflict, I think, for Indian people, because we'd been using these for generations. We put this salve on our skin, and our skin healed. We took a medication or a plant or an herb, and the pneumonia or the chest symptoms went away. And then 2 or 3 decades later, we're told this doesn't work. And I think a lot of Indian people said, we've used this all our lives, and for generations, of course it works, but somehow our medicines were discounted.
The physicians of the early 19th century, while differing in their diagnoses and their treatment, were rather unified in declaring that just everybody else was a quack. 1847, the American Medical Association is formed, and that's one of its major purposes, is to get rid of the quacks. So the early profession was striving to become respected and to gain power.
Land cession treaties in the early 1800s opened Indian lands to loggers, miners, and settlers, severely impacting Ojibwe access to traditional foods and medicine sources. Reservations were established in the mid-1800s, confining Ojibwe to a decreasing land base, where treaty commodities began to replace their traditional diet.
And so diet has changed drastically in Indian communities since the beginning of interaction with the non-Indian. Wild rice is a very healthy food. It's a very natural grain and cooked in a lot of good ways.
People were displaced from lands they were used to. They were used to hunting, they were used to gathering food there. They knew the patterns of nature, they knew how to survive. And all of a sudden you're displaced to a different area where you don't know the patterns to survive. And on top of this, you had a culture that was coming in and pushing you. You were placed on reservations and many times moved to areas that no one else wanted. Food wouldn't grow there. You know, water was not abundant, game was not abundant. So very, very early, just being put into places where you were not meant to survive. I truly believe that, and many people didn't, and that was a factor in not being healthy in the early days.
Eventually, they started putting restrictions on the hunting and trapping, gathering of birch bark, see, because those are the things that we did during the winter to survive. We lived off the land. They put a stop to that.
In an effort to force Native Americans to become more like Euro-Americans, the United States government dealt the Ojibwe another extreme blow in 1892, when the rules for Indian courts outlawed many aspects of Ojibwe culture, including religion, traditional ceremonies, the use of medicinal plants, and the practice of traditional healing methods.
We couldn't practice that. One of the ways we were able to maintain our health is going to ceremonies. I believe at that time the frustration started to set in. We didn't know how to deal with it, so the drinking started, fighting started, the anger was there.
Basically, all of our medicine people were underground. And we basically
If they provided health services, they provided to them very privately, and no one knew who they were.
The federal government's assimilation policies during the late 1800s and early 1900s targeted Indian children through government and missionary boarding schools designed to strip children of their Native American identity.
When my grandfather was small, he was taken away from his family and he was put in a Catholic boarding school, and they beat him on a pretty regular basis. And if he tried to speak his language, they would beat him. And even up until he died, he didn't really want to talk about that very much because he did not want his children to be Indian. He didn't want them to speak their language. He didn't want them to look Indian. You know, he spent his life trying to be somebody else.
There was a shame element introduced and reinforced again and again about whatever being Indian was. It was truly an assimilation process that was overall in many ways a failure, but overall in many ways a success too.
While I was there in Washington working at the archive, they brought me this long box. It's about 2 feet by 4 feet full of files, and I opened it up and I could only describe it as the death files. It was all the records of kids who died at boarding school, and I remember opening up, you know, one of the first files, and it said, you know, generally they were telegrams that were sent, and there were copies of those telegrams. You know, regretfully, regret to inform you that your son died at Ganado Indian School on such and such a date due to illness. Regret to inform you that your daughter died at Ganado after running away, after being hit by a train, was found in a field, frozen. You know, it was just these horrible stories, and it was just file after file after file. And
my grandmother Hoole tells me a story, used to tell me a story. It was during the time of the big flu epidemic. It must have been probably around World War I in that period of time. And she said a lot of people were dying. She said, and she remembers her grandmother taking her, and they went way out in the woods to live during this time so she wouldn't get sick. And her dad would bring them food. But she said when they went out in the woods, they walked by the cemetery. She said, and the caskets were piled so high that the people who were burying couldn't keep up.
There's almost an intergenerational depression and anger that really comes out at the oddest times for many of us, quote, modern Indians today. And we have to acknowledge it's not just today's world that has impacted our lives. It's all of these other things that have occurred over the past 200 years.
Faced with increasing deaths of Native Americans nationwide, in 1802, Army doctors began inoculating Indians living near military camps during smallpox epidemics. Health care for Native Americans was transferred from the Department of War to the Department of Interior and the Bureau of Indian Affairs in 1849.
The Army actually took a look at all of these Indian people that were dying and decided that they had to set up some sort of health delivery system for these people. But one of the things that's written into many of the treaties is that health care will be provided. So that was sort of the root of how this government will pay for the land that was taken. And health care was part of that deal.
The reduction of the death rate is not its primary interest. It is working rather to increase the vitality of the Indian race and to establish for it a new standard of physical well-being.
Tuberculosis was a main killer. And it not only killed, but to cure it, you had to send people away from home. Many of the people that had TB were children. Can you imagine taking children, and there are children today that can remember this, being sent away from home 1, 2, 3 years and longer, very young ages, and put into TB units.
The only hospital we had was in Hayward. It was an Indian Health Service hospital, and many of us had to go there for our health care. As a young child, I did go down there and spent about a month. And for me, that was probably one of the most traumatic experiences, because my mother and dad took me down there. I can remember them taking me there, leaving me there, and then I didn't see them until they picked me up.
Healthcare in Indian communities was very poor. It was from the days of the old horse and buggy, where there was not any access to a medical provider. So therefore you had a situation where people used to go without and let medical problems fester and encompass their entire life, and subsequently died from some simple things like pneumonia. And then a lot of stories I've heard that it was kind of a scary time, because you're not quite sure, some people might have went off and never came back, and you didn't know really what happened until they brought the body back.
In 1949, 100 years after the BIA was designated to manage health care for Indian people, it was chronically underfunded and still had only 96 full-time physicians to staff 81 hospitals serving over 500,000 Native people nationally, even though infant mortality of Ojibwe children was more than twice that of the general population, and life expectancy was over a decade less than most of the country.
The federal government decided they would start building facilities on the different reservations as the reservations were established. And hospitals and clinics were built on various reservations, and they were staffed by federal employees, and the federal government decided what health objectives would be established, what health needs we would look at, and it was a big step forward. But as this step went forward, we're the Indian people who are recipients of this voice in deciding what our health status is and what our needs are and how we're going to address them. Again, it was a step forward. We were getting hospitals and facilities over time, but it was run primarily, again, by the federal government.
After decades of underfunding and neglect, Indian health programs were transferred from the Bureau of Indian Affairs to a new division under the Public Health Service Department, creating the Indian Health Service, known as IHS, in 1955. The newly formed government agency inherited 2,500 staff members, 48 hospitals, 13 school infirmaries, and the responsibility for nearly 500,000 Native Americans and 35,000 Alaskan Natives. IHS quickly zeroed in on controlling the spread of tuberculosis.
All Indians, like all other Americans, face a common enemy: tuberculosis. There are 7 sanatoriums in the United States just for Indians. All of them are good places where you can get well if you go soon enough.
As the Indian Health Service geared up to address health issues on or near Indian reservations, the BIA, through the Relocation Act, lured Indians off their reservations into major cities with the promise of jobs, training, housing, and education.
And I went back to Minneapolis and went to school for 1 full year, graduated from LPN training in 1960. After graduation, I worked at a couple hospitals in Minneapolis for a while, and that did not seem to be me. It seemed like I wanted to take care of the Indian people and utilize my education taking care of my own. So I signed up for the Indian Health Service. At that time, the Bureau of Indian Affairs was trying to get Indian people off the reservations. So we got sent to Cleveland, Ohio.
Major problems that we had to deal with the early relocation, again, was the TB. A lot of the diseases that they had on the reservations were the same diseases that the Indian people had here in the Minneapolis area, because a lot of the people went back and forth. And a lot of times what happens when families would move to the urban area, they would all end up living together, so they ended up living in they had very crowded housing. And a lot of times maybe they didn't have the proper heating, the proper ventilation, this type of thing in those homes. And so again, you had a lot of the airborne diseases these people would be affected with.
Another government effort to assimilate Indian people came from social service officials. They systematically removed Indian children from their families and placed them in non-Indian homes.
2 of my children was taken away and I couldn't find them. The churches wouldn't tell me where they were. I testified at the Indian child welfare hearings in Washington, D.C., and I believe it was in 1973. And I testified about my kids being taken out of Chicago and taken over the state line and adopted in Wisconsin, 6 months or 3 to 6 months after they were taken.
After a concerted effort from Indian leaders across the country, Congress passed the Indian Child Welfare Act in 1978. The act sought to stem the tide of Indian children being removed from their families by placing them in Indian foster homes until families could be reunited.
I got in touch with my kids again, so I was real grateful for that. The little Indian kids, are bonded to a larger family, like the nuclear family, and then all these things are in the kids. They really can't be separated from the Indian nation. They can't. I worked in the food stands, I didn't work in the food stands, setting up food stands at the powwows to make money. What I wanted to do was have families working with me so they could learn to work together and laugh together. We got to go to powwows and just eat Indian food, and travel together. And it gives me a lot of satisfaction to know, that Indian families can make it together. That we need to support one another in our efforts to keep our kids within the family units, and it gives me a lot of satisfaction to know that I could be a part of that, because I worked really hard at keeping my own family intact.
The civil rights movement and the war on poverty brought attention to the serious conditions that existed in American Indian communities. The Indian Self-Determination Act was passed in 1975. It gave Indian tribal governments and organizations an opportunity to take control over provision of health services by contracting directly with the federal government. As well, the Indian Health Care Improvement Act of 1976 gave funds for urban programs, medical scholarships, and access to reimbursement. These acts gave Indian communities a much greater role in the delivery of their own health care.
Now, self-determination means that the communities where the programs exist have the opportunity to help mold and design those programs. Who knows more better than the people who actually live and work and serve those communities?
Indian self-determination has received support from all branches of the United States federal government. All presidents from Richard Nixon forward have signed executive agreements and orders affirming the government-to-government relationships between the federal government and tribes. There have been key legislative victories and court decisions which have supported Indian self-determination and the rights of tribes to provide health services for their members in their delivery areas.
Government-to-government relationship, what that does, and I see Indian tribes holding the United States federal government accountable for these legal, documented agreements that were made, and including in that was health. Now, tribes have worked independently as sovereign nations and together as Indian nations united to try to address many of these health funding, health status, health issues that have emerged over time.
When the Indian Self-Determination Act was passed, many federal bureaucrats were hesitant to turn over control of hospitals and clinics to the tribes. But in tribal communities, there was enthusiasm because we would finally be able to exercise some control over hiring policies and health services.
Tribal programs and tribal clinics exceeded all expectations, and by 1998, there were 37 IHS hospitals being run and about 59 outpatient clinics nationwide. Tribes were running 12 hospitals and 155 ambulatory clinics countrywide. The enthusiasm turned into very good health statistics as well, because during the same 20 years, there was about a 58% drop in infant mortality, and about 2 decades had been added on to the average lifespan. So it was an enormous success. But there are still some challenges in healthcare, and many of the statistics remain troublesome for tribal programs and for the Indian Health Service.
Unfortunately, it's taken 6 to 7 generations to get where we are today as far as the health status of Native American people goes. It's my expectation it'll be generations, perhaps 2 or 3, to address some of the serious health concerns that Native people are facing today. I think we've seen the nature of diseases change over the years as lifestyles become more sedentary. We still treat a lot of communicable diseases today in our clinics, but most of our diseases nowadays are chronic in nature. We know that Native people have higher rates of many different diseases, including heart disease. Diabetes is 3 times the rate amongst Native Americans as it is the general population. And certain cancers, we know that there's a 2 times greater risk for American Indians to have lung cancer, a 3 times greater risk for American Indian women to have cervical cancer. We know that the Indian Health Service does not have enough resources to meet all the healthcare needs of tribal programs, and therefore many tribal governments are doing their best to supplement health programs on reservations.
In 1978, there were hardly any tribal clinics on the reservations in Wisconsin, Michigan, and Minnesota. Today, there is an ambulatory care clinic or a hospital in almost every small and large reservation throughout the 3-state area. Now, because the size of reservations varies so much, these clinics range from part-time doc, 2 operatory, small exam stations, to full-blown 10 to 12 doc, 30 exam room, ambulatory care clinics with lab and x-ray and dental and pharmacy. So there's quite a variation between the kind of clinics that are in operation, but it's been a very successful adventure, the Indian Self-Determination Act.
Also in 1978, the Freedom of Religion Act was passed, which finally permitted Native Americans to practice their spiritual beliefs and traditional healing methods openly.
Some of the services we provide here are our clinic, ambulatory clinic. We have an optical office here. We also have pharmacy. We have our business office, and they basically run the contract health services program. And back in '95, we started our third-party billing office, and we do have that available here also. We do have a health and wellness center with a conference room, and many times that's used by the staff to do health education programming.
Like the Flambeau, we have a very strong health program. We have a staff of about 50. We have 2 family practice physicians, both of them doing OB. They are supported by a wide gamut of healthcare resources. We have laboratory, x-ray, dental program. We have community health, sanitarian services, community health services, mental and behavioral health services also are found in Lac du Flambeau. So therefore you can see that we've gone through a wide gamut of change over the last 40 years.
The Indian Health Service continues to operate 3 service units in Leech Lake, White Earth, and Red Lake.
Our facilities last year seen approximately 60,000 outpatient visits. We do have an inpatient bed size 13 beds, and we average about 5 patients a day, and that stays pretty stable. The eligibility for anybody seen here is they have to be Indian descendant of a federally recognized tribe. And if they can prove their descendancy, they can receive services at Catholic Hospital. And so we have grown through the years with more patients. We average about 40 to 50 new charts every month. So majority of all the positions that we do recruit for, we do recruit for Indian preference. The people that come here, they stay. We encourage staff to continue their education and come back and provide care to their own. So we continue to have to be creative and innovative with our facility.
Because tribal health programs can offer all of their services under one roof, it's much easier for them to integrate public health services with ambulatory care, dental, pharmacy, behavioral health counseling, substance abuse treatment, and prevention intervention services. And this really enables them to provide a much more holistic kind of treatment to the community and to individuals.
At our clinic, patients can receive alternative care, things like massage therapy, homeopathy, acupuncture. Also, we provide traditional medicine, too, as a service to our patients.
It's alive today, and it's coming back more and more. I notice that now they're starting to have different types of ceremonies that they're having. Like we have the Jisakan nowadays, things that we have medicine men that come from other areas that are bona fide medicine men that come for healing. And we have all sorts of things that are coming back.
I think it's important to have the medicine people be available to Indian people here in the metropolitan area.
I don't think there's any conflict between the 2 types of medicine. So when someone has a physical problem, that health problem may come not just from a physical imbalance, but from a spiritual, a mental, or an emotional imbalance. And when I discuss things with a client, we try to discuss some of the forces that might be affecting the person to bring about that imbalance. And there are different things that I can do to try and help address the problem. But with some of those forces, there's not a lot that I can do. And the medicine man is able to offer a healing on a much more profound level.
To provide a full range of health and social services requires additional financial resources and reimbursement funds.
One of the stereotypes that we deal with, I think, as Indian people is somehow the federal government pays for all of our health care. This is not true. The resources are very limited, which means in many ways, Indian people, there is health care they don't get.
One of the most critical things we had to do was develop our business offices so that we could bill insurance companies and others for the kind of work that we were doing. The world has gotten so complicated and the systems have gotten so complicated that it wasn't easy for us to become a player in the system.
The medical business is not at a standstill. You have to stay upgraded, you have to stay updated, and you have to be able to give a good picture of what you have to offer, and you have to be competitive with the outside. If you're not, then of course you lose your income. We bill all private insurances that are not tribally affiliated, and we're able to bill, you know, Medicare and Medicaid insurance, and because we have our inpatient, we get pretty good billing on Medicare.
I see health delivery in tribal communities as a three-legged stool. You have to have the federal authority and federal support. You have to have tribal government authority and tribal government support. And you have to have experienced, passionate staff who want to do a good job. Those three things make the delivery system in tribal communities second to none.
Self-determination has also meant that many Indian people have had opportunities to come back to the reservation and provide services to their communities. 17 years ago, I was recruited back to the reservation to serve in the health program, first as a public health nutritionist and also then as an administrator in the program. And it's been a great experience for me. I've had an opportunity to use my skills and come back and serve the people from my band.
When I was in college, I felt that I always had to do more than anybody else to be perceived as not just being a quota. And if it took me forever to get where I am, that's okay. I couldn't have done things even a day faster than I did. My parents owned a Good Luck Tavern of all names, and wasn't doing very well, and my father actually shot himself when I was, I don't know, maybe 4 years old. My mom left us alone, probably not infrequently when we were little kids, and we burned the place down. So when we were sick, she would always be doing things for us, and she knew which herbs and things to use, and she would go into the woods and get things, and that's, pretty much my connection with any early health care. She finally got running water and indoor plumbing in 1985, which was, for me, was a big thing. I'd always hated winter before that, and we melted snow for water a lot of times, and having running water is nice. Even now, when I flip on when I take a shower in the morning and hot water comes out of the thing, I still think that's pretty cool. And then went to high school in Cook, and I wasn't a stellar student by any means. And when I went to UMD in 1976, I think I mostly went there because they had running water, because it was warm, and a bunch of other things. And not so much for the college. Actually, my first 2 quarters kind of bear that out, and my GPA after 2 quarters was 0.00. So I didn't pass anything. I'd taken a physical agility test and a written test for the Virginia Fire Department a year before that, and they called me in for an interview, and I got that job. So I actually worked as a firefighter for 3 years, and in the last year and a half of that, we had a paramedic program that started there. So I was a paramedic for a year and a half, and that's kind of when I decided that's what I wanted to do, was do medicine. I went back to UMD, and actually, then I was 30, and that was 1988 when I decided to go back to school, and I had to make up all those previous credits. I think I was the #1 student in almost all of my classes. And I thought that if I did emergency medicine in a big city like Minneapolis, then I could do Indian healthcare. A lot of Native patients, that's the only care they get, is when they're in the emergency room, and don't really have doctors that they follow with on a scheduled basis. So I knew I either wanted to do family practice or emergency medicine. And it was a pretty hard decision. So right now I'm a physician at the Bimaadiziwin Clinic on the Fond du Lac Reservation in Cloquet, Minnesota. If you look at the Association of American Indian Physicians, there's probably 400 or 500 Native docs, but there's 875,000 prescribing physicians in the United States. 400 isn't a very big percentage of that. So we do have a long ways to go. My hopes for the future are to try to have more Native people working in their own systems.
I think there are a lot of traumas and assaults that are in the recent past that Indian people have experienced. These are still in my parents' memory banks. They're very strong for them and very strong for me. Whether that's the boarding school experiences that we've had, whether it's the wars, the disease, the traumas, the onslaught of somehow there's something wrong with you for being Indians, your spirituality, your religion, your medicines, these are all have taken on somehow a negative impact. Those are the challenges that we have today. I think there's a brighter future there for us. There has to be. And our challenge is to work together to get there. We're going to have healthy people. We're going to have educated people. We're going to have people that are proud of their heritage, that know they're Indian, that continue our culture, because that's our strength. I know we're going to do that. And to me, that's the hope. That's the hope.
And in the medicine lodge, that old man, his name Pipe Mustache, and his Poggan, that was his name. And Pipe, in the lodge one time, he telling a story, and he started yelling real loud, you know, and he always spoke in Ojibwe, you know, and I told him, and he's almost speaking English, you know, and I'm not talking Ojibwe, he's a guy. So he started talking in English, you know, he said, and he started yelling real loud, you know, and he said, he was telling everybody, he said, you come to this lodge, he said, you want to learn how to live a long life, a good life, and a healthy life, and that's what you want. That's what you want, he said, that's why you come here. And you want to know what the secret of life is? I've been in this lodge 84 years. I'll tell you what the secret is. I'll tell you. And he went on and he told the story, you know. He got down the story and he said, you still want to know? You want to know what the secret of life is? You want to know? You want to know what the secret is? I'll tell you what the secret is. I'll tell you. And he went on another story. He did that for almost 3 or 4 times. You know, and he finally got to the last one. He said, you want to know what the secret is? I'll tell you what the secret is. I'll tell you right now. And he looked at everybody, and he had a cane, you know, and he was kind of older in his life then, you know, he said, do you want to know what the secret is? I'll tell you, I'll tell you, I'll tell you. And he looked at everybody and he said, hang in there, and he sat down.
We do kawa aneshina bedo he midashkaya geta Ojibwe moa Waasa